All right, welcome to the anterior upper arm anatomy. And as you can see, I've kind of drawn some of the bones of the anterior upper arm right here. And even though it's not the best drawing, I think it'll get the point across of what we're trying to go over today. And we'll go ahead and start with the osteology of the anterior upper arm first, and then we'll move into muscles and things like that. So let's go ahead and get started with just naming some of the things that I think are most important in this diagram. It's important to note that this is the right anterior upper arm, so the face will be somewhere right here, and it'll be looking at you. So let's just draw a mouth right there. And so we'll be looking at the front view of this person, and obviously their face is facing the front. Okay, so let's label some of these bones here. Just label them in green, that's fine. So this one right here, and this is a more posterior bone, which you can't really tell here, but this is the scapula. And there's some angles they label on here. The superior angle, which makes sense, right? Superior. And this is the inferior angle. This is the lateral border. I'm sorry, this is the medial border right here. Medial border, because it's more medial to the person. And this is the lateral border as well. So those are kind of intuitive, but I just wanted to go over those real quick. Some other important bones here. One here, this is the clavicle, which is famous for breaking. And this is the acromion. And this little process right here, so the acromion and this process right here, which is called the coracoid process. These two, the acromion and the coracoid process, are actually just extensions of the scapula. They actually are the scapula, part of the scapula, they're extensions. This acromion actually comes off the back and wraps around and touches this clavicle, and this coracoid kind of loops off the front here. And these processes, the acromion and the coracoid processes, will be important for origins and insertions of muscles. So that's why they're kind of important to understand. All right, so let's go into these bones here. This is the humerus. And these two bones right here, this is the ulna, and this is the radius. And I remember that too because the radius is normally like, reminds me of the outside of a circle or the outside. So that's how I remember that the radius is normally towards the lateral part of the body, which it is here, as this is medial, right here, this is medial. And then this is lateral, just to orient you. So I just want to dive a little bit deeper into a little bit more detail, or at least as much as we can get out of this drawing, and talk about some other landmarks that are important. So this right here, this little cavity where the humerus and the scapula meet, right here at this little cavity right here, this is called the glenoid cavity. Then this right here is actually referred to as the head of the humerus. Right here, and then this is normally split into two, which is like kind of getting tough with my drawing here, but this one on the right here, this kind of greater outpouching, it's going to be the greater tubercle. And this lesser one right here will be the lesser tubercle. So another important feature of the upper part of the humerus is the intertubercular sulcus. It lies right in between the two tubercles, which makes sense. Right here, and that's important for muscle insertions later when we get to that. Some more important features here, this is going to be the medial epicondyle. And then that would make this lateral epicondyle. There, I can actually just use that word. So medial epicondyle here and lateral epicondyle here. Finish that. And then also just above that you have medial and lateral condyles. And then above that, these become the supracondylar ridges. So you have the medial epicondyle, the medial condyle, and medial supracondylar ridge. There is also something called the deltoid tuberosity, which hangs out right about here and kind of wraps around. Just a portion of the bone that is where the deltoid muscle inserts right here. So I wanted to point that out as well. And now we can go ahead and look at some muscles of the anterior upper arm.